Okay, I will explain you today a few topics. Yeah, we will talk about shocks and we will talk about fluid and electrolytes, and I think that it will be more clever than if we just talk about fluid and electrolytes or just talk about shocks. What you need to understand, when we talk about shocks, we always will talk about fluid and electrolytes, yes? Because if we have shocks, they always will change our fluid and electrolyte systems. In surgery, often we talk about hemorrhagic shocks. Yes, it's shocks where we have loss of volume of fluid. Yes, hypovolemic shocks. And we always need to talk about pain shocks. Yes, when our patients, we do the surgeon, and we always have our patients always have pain. Yes, it's normal for us, not for patients. Yes, and we need to understand that pain shocks, it's a hypovolemic shock too. Let's start talking. There in Russian you see a hemorrhagic shock. In this situation we talk about trauma or hemorrhage or bleeding. Yeah? When our patients have bleeding, there I think we need to talk about less of volume. Less of volume, what lead to changing in our vessels, in our brain, and we start talk about sympathadrenality system. When we talk about activization of sympathadrenality system, we talk about hyperfunctions of we have kidney and upper adrenal. Yes, they will do a hyperfunction. Hyperfunction of
adrenal glands.
Yes, lead to hyperadrenal
Secretion.
yes, hyperadrenal secretion. And look what happened. If we have a hyperadrenal secretion, and first of all we see a patient and he have a high rate of pulse, and high rate of pressure, and it's not a compensation. You know that if we have a less pressure, our pulse rate will grow up. Yes, because organism understands that if we haven't got enough pressure, we can compensate it with high rate pulse. Yes, but there you look another situation. We have a high pulse and we have a high pressure. Yes, what we can do and about what we can think now, that our patient have some problem. Yes, like shocks, for example, if we know that he have a bleeding or he have a trauma. Or maybe some people in normal situation have this pressure, this condition of pressure and of pulse. Okay, if we understand that it is our shock, yes, let's talk forward. When we have a hyperadrenal secretion, we will talk about hyperventilation, because when we have high rate of pulse, our lungs our organism understands that we need breathing faster. Yes, and it's a reason of this situation. Our blood go to our organs, yes, and when they come into organs, then they give oxygen, yes. And now look, we have high rate. That means that a very big volume of our blood come to our organs, yes, and that means that we need have more oxygen, yes, and our lungs breathing faster, and it lead to hyperventilation. The hyperventilation will lead to hypercarboxyoxygen, hypercapnia. Okay, this is first what we have bad. High rate of oxygen of carbon oxygen. Yes. What else? Our organism try to compensate all this situation and understand that he need more volume of blood. You know that in normal situation we have some depot of blood, yes, some places where our blood sleep, yes, and our organism just say wake up and go to help organism. And some volume of blood will go to the vessels. This leads to high rate of volume. And all this, there we lose volume, there we high volume, and this leads to normal volume of blood vessels. Then what's happened? Our organism understands that that's not enough, and we need something more. Yes, he lost some volume from bed, yeah, no, where blood sleep. He take some more breathing, but that's not all what he can do. You know that our organisms have many vessels, yes, and we have big central vessels and a small peripheral vessels, yes, and now organism understands that if he have organs what really need for life, the peripheral vessels what lead to skin, to fingers, is not very necessary, yes, and he compressed them, and blood from all peripheral vessels go to central, yes. This calling centralization of
Blood.
not blood,
Blood circulation.
yes, centralization of blood circulation, yeah. What else? What forward? This lead to hyperperfusion of all organs, yes, and this lead to metabolic acidosis, because our blood come to organs, and she haven't got many time for do all process of oxygenation of organ, yes, and this lead to acidosis, and we call it metabolic acidosis. Then our organism understands that he need fight with metabolic acidosis, yes, and what he do? He dilatate a vessels. When he dilatate vessels, he don't want to saving blood, but when he dilatate, all blood go to vessels and stop there, because organism haven't got a normal pressure and normal rate of pulse. This lead to saving of some blood there in vessels what are dilated. This all situation lead to less of venosis.
When it's written.
When is what?
Written.
To the heart.
Yes.
When it's written to the heart.
When it's written. And then if we haven't got normal volume in heart, we have a less of hypovolemia. Yes, less of volume in arterial circulation. This lead to ischemia of organs. Yes, our acidosis. What our organism, of course, want to help. Yes, to compensate. But this all situation lead to decompensation of acidosis, and this lead to what happened? Our vessels will dilatate, and all fluid in blood go out to interstitium. Yes, you know that blood is mixed of fluid and of elements. Yes, like erythrocytes, white blood cells, and others. This lead to hemoconcentration. Yes, because fluid from blood go away. Hemoconcentration start a process of DVS syndrome. DVS. Maybe in English it is another word.
DIC.
Maybe.
Dissemination.
Coagulation. Yes. This DIC syndrome. Yes. Yes. Why are we afraid DIC syndrome? That's right, but not all right. How we will give to patient anticoagulants?
IV.
IV?
Intravenous.
Intravenous. Yes, but what substation, what density, what the drugs we need give, what transfusion?
Heparin.
Heparin. No. Look, DIC syndrome, it's syndrome when we will lost all coagulants. Yes? Absolutely all. Yes? That lead we need to give to patients coagulants. Yes? Not anticoagulants. We need to give him coagulants. How we can do it? Plasma transfusion. Yes? Plasma transfusion. Just this will help patient. Okay, and now let's talk about vessels. These three conditions of vessels. First condition, it is normal vessel.
Dilated.
Yes, the second is dilated.
Constricted.
And third constriction. You remember I show you this paint, this draw in the last semester, and there we talk about fluids and classifications of fluid, how we can help patients. Yes, crystalloids, colloids, and others. And you remember that I want thinking that you remember about endotheliositis. What do a wall between vessel and tissue? Yes? You understand that there is interstitial. Yes? Okay. And look, you see that we have some space between endotheliocytes. Yes? And this is normal situation because it is a microscopic level. Yes? It's a big zoom of vessel. But our blood is like fluid, yes, and with some micro elements. And look, in normal situation, blood we can see like a ball, yes, and in normal situation, ball can go away. But we know about osmosis, we know about oncotic pressure and other fluid management what help our organism don't treat our balls. Yes? But look, when we talk about the dilation of vessels, we understand that endotheliocytes don't grow up. Yes? They are in a normal position, in normal size. And that lead to increase of space between endotheliocytes. And now look to our ball. Our ball can go away from our vessel, yes? And another situation, when we have a constriction, yes? Endotheliocytes don't have another size. Yes? And that lead to our balls don't go away to interstitium. Yes? But in normal we know that sometimes they need go away. Okay? This is three condition of vessel. And now let's talk about it situation with shock. With shock. Look, we lost some volume, yes? And now we need help patient. How we will do it? With some transfusions. But what transfusion we need do? You remember that we have three type of fusions. Yes, first is crystalloids. The second one is colloids, and third one is blood components. When we talk about crystalloids, we talk about water with some sodium. And we have fusions like physiological solution, yes, natrium, chloridium. We have solution of ringer, solution of disol, trisol, and others. Maybe in your country this solution have another calling. Yes. About colloids. When we talk about colloids, we need to understand that density of colloids is more higher than density of crystalloids, because this is not a water. This is something another, some gel substantial with some sodium. And blood no, you know that blood is normal physiological solution in our organism, and blood components have many types like blood, like plasma, like protein, and others. We'll talk today about this one. Okay, and now what you need to understand when we talk about vessels and these solutions. Our solution of crystalloids have this size of molecules. Don't see? Our solution of crystalloids have this size of molecules. Our solution of colloids have this size. And you see that colloids is bigger than crystalloids. And if we use crystalloids, they can go away to interstitium. And 75% of crystalloids always will go to interstitium. If we talk about colloids, they have a big size and they can go away. When we talk about colloids, we talk about fluid, what can help when we talk about less of volume. Now, when you know this situation, how you will help patient with shocks? With crystalloids or with colloids? You remember that when we talk about shocks, we talk about less of volume. Yes? Okay, what do you think?
I think crystalloid.
You think?
Colloid.
You think?
Crystalloids.
You think?
Crystalloids.
You think? Okay, why you think crystalloids?
Less volume. Because of less volume.
Compared to the colloid.
Okay, look, you answer right, but you think not right. You think right, but you answer don't right. Okay, look, when we talk about crystalloids, we need to understand that 25% will stay in blood vessel, yes, and 75% go to interstitium. It's not good for us, but it's good when we вспомнить.
Remember.
Yeah, when we remember about osmosis. When we talk about crystalloids, it's a normal osmosis in vessel. But when we use colloids, osmosis will change because this ball of colloid will take all fluid to himself from interstitium. Absolutely all fluid. And where we afraid this? In what organ we afraid this? Look. We have vessel with
Colloids.
colloid, yes? And we understand that this colloid will take all fluid from interstitium. And we have one organ, two organs. Kidney, yes? This kidney. Because when we talk about using of colloids, he lead to necrosis of kidney interstitium. Yes? Because he will take all fluid from kidney. And our kidney will say goodbye. Goodbye. Okay. You write that you want compensated volume, yes? But if you will start from crystalloids, and then when our interstitium will have many fluid, you can give to patient colloids, but only if using at first of all crystalloids and then colloids. Okay, shock index. It's the most easiest in all your study, how I think. Shock index or index of Algover is a pulse rate delayed for systolic pressure. For example, you have patient with pulse rate. Oh no, let's talk about normal. Now my pulse rate is 82 and pressure 120 or 130, I think. I will say 120 and say 80 because I don't like mathematics. Now what we have? 8 delayed to 12.
0.25. 0.25.
0.25.
225.
Okay, 25. Okay. This is normal situation, yes? And now let's talk about some critical situation. For example, our patient have pulse rate 100 and our patient have pressure 100. One. It's not normal. Yes? Now you will have one question and then we will talk about the stages of shock when we talk about shock index. How we think when we have we start talking about shock? When shock index is 0.25, 0.5, 0.75, 1 or another number. How you think? How you think?
It should be less.
Less than what?
Less than 1.
Less than 1.
Less than 1. Less than 1. What do you think?
Less than 1 is normal.
Less than 1.
All of you, of course, are right. But I will ask you, 0.8, it's normal or no?
No.
Not normal. That means that we don't talk about 1, yes? Now we talk about 0.8, yes? But now I will ask you, 0.6 is normal or not?
It is near to.
Near. Not normal. Now we talk about 0.6. 0.5 is normal? Yes.
Yeah.
Yes, 0.5 is normal. Look, you always can remember it if you will take some numbers of pulse rate or of pressure. Yeah. For example, take pulse rate normal is 60 to 90. Yes. And arterial pressure, not arterial, systolic pressure is normal 120. Yes. Or maybe 130. And always you can start delayed and then you will understand that this is normal and this is not normal. Okay? Okay. we delayed 60 for 120, how much we will have?
0.5.
0.5? Yes? Okay. Okay, this is a rate of our shock index, and we will talk about these numbers because Dr. Shevchenko gives this score, and I like Dr. Shevchenko. He is a good man. Okay. When we talk about shock index less than 0.7, it's normal. 0.81 is 1, 1, 2 is 2, more than 2, 3, and when we don't have any numbers about pulse rate and pressure, we talk about fourth stage. But this is shock index is very easy, but you need to understand that it's not always correct. And now I give you this exercise to understand, to say what shock index we have.
First is 0.8.
44.
Point
8.
83.
1.1.
1.11.
1.1
1.
2.
After 2.
and 2. What that means? What shock we have in first situation?
First.
First, in second,
First.
first, in third,
Second.
in first,
Second.
Third.
Second. Don't do this. Second.
second, or maybe third. Yes, and now let's look to all these situations. If we talk about first one, we have a normal pulse rate. Real, we don't see it. When we talk about first situation, we have pulse 84, yes? And pressure 100 to 90. You can придумать.
Think.
No, okay. You can find in your brain this situation when patient have this pulse and this pressure. Sometimes we can talk about normal. Yeah. If, for example, it is girl, yes, he has some bleeding, real. Okay. Drop with knife herself. But in normal situation, her pressure is 90 to 80, yes, or 90 to 60. That means that she has some stress situation, yes, and this lead to up of pressure, growth up of pressure, yes. But now we talk about shock index 1, about shock stage 1. It's not good, yeah, in this situation. But maybe this is another situation when we talk about men, yes, who have weight of maybe 100 kilograms, yes, and his pressure is not 190, yes, in normal situation. Okay, another one, second, we have shock index 0.8. Yes, and we talk about first shock stage. But look, we have pulse rate 100 and we have pressure 120. And we can thinking about two situations. Maybe first of all he just run, yes, and have high rate of pulse. Just run. Normal pressure but high rate of pulse. Or another situation when, for example, she really have a shock, yes, and we see that pressure don't changing because when we talk about pressure, when we talk about all pathology of shocks, we remember that we have compensation from organisms when our pressure will grow up, yes, and pulse rate will grow up. And now we need thinking about this, yes. Maybe it's really shock, or maybe it's a situation, organisms compensation. The third one, shock index 0, 0 and stage 0, 0, 1.81 and stage 2. And this situation you always can remember a girl who have a pressure in normal 90-60, yes? And maybe she just run, yes? Or really we have patient with bleeding and this change of pulse and pressure. And the last situation, when you see arterial pressure 60-40, you always start thinking from second stage or third stage. But sometimes you will thinking about fourth stage. Because, for example, now he have this pressure, few seconds, and he haven't got pressure. Too hard to help people in this situation. And now I ask you a question. If you have this patient, how you will help him? What you will do? Use all knowledge from this lesson. What do you do for patients who have less pressure?
Vasoconstriction.
Yes, and what you will do?
Glucocorticoids.
Maybe after. It's not the first step of helping. Yes? First step is a crystalloids. Yes? What volume of crystalloids you will use in? So 30 milliliters per weight of patient. For example, for me, it means 2,000. Yes, 1,000. Yeah. To 2100 milliliters. Yeah. It's a big volume. You remember that our blood vessels have just 5 liters, yeah? 5 or 6 maybe.
5.
No, sometimes, yeah? 200 milliliters. How you will do a transfusion? Intravenous, yes? But how? Dropping or when we talk about dropping, we have drop, 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 drop. Or we can use
Drop.
drop,
No. Direct infusion.
direct infusion. Yeah, you're right. You remember that our systems have a ring, yes? What if we will change? Dropping will be faster or will be slowly, yes? And you open it for all, and you see a direct fusion. Okay. You use crystalloids and do a dynamic of pressure and pulse rate. You can give glucocorticoids, but look, if you give glucocorticoids for patients who haven't got a fusion, you will kill him. Yeah. Yeah. You know why?
Because it is not the, it is used in severe cases when there is no other treatment.
I give you example. If you take horse, yes, and she won't eat horse, she won't eat, but you say go horse, she can't, she will die, yes. And now eat for our patient is fluid, yes. If patient haven't got fluid because he have hemorrhage bleeding, yeah, he will die if you will use glucocorticoids, because for us glucocorticoids is like men who say go. Yes, it's like stimulation, yes. But you can think in that when we haven't got volume, we have a heart without fluid, yes. And if it will working, it don't work normal, yes, because no blood, no money, yeah. Okay, guys, that's all what I want from you today.